The COVID-19 virus has become a global pandemic, affecting everyone, some more personally than others. Raise your hands if you've been to a supermarket in search of sanitary products. Now keep your hands raised if you did that, not because you knew how to stay safe, but because you were affected by social fear. I became more interested in this topic because of my line of work. I work at Kroger Marketplace, so I've seen firsthand the fear, frustration, and worry of some customers. I would like to inform you about the beginning of the virus, symptoms, preventative measures, stigma, and some facts associated with the virus. An article posted by NBC News on February 28, 2020, titled "Where Did the New Coronavirus Come From? Past Outbreaks Provide Hints," provides us with some information that researchers have found. The virus comes from a family of viruses that can cause illnesses ranging in severity. The virus first infected China in December, and many people thought of it as a biological weapon that was released. However, research begs to differ. Scientists have identified that the makeup of the virus is similar to the makeup of coronaviruses found in animals, such as bats. This proves that the virus was not created in a lab. The DNA sequences show, however, that the bat viruses cannot infect human cells. Thus, the virus infected an intermediate animal, mutated, and then later infected human cells. According to the U.S. Center for Disease Control and Prevention, some symptoms include fever, cough, and shortness of breath. These symptoms, however, are mild and can be recoverable. Some symptoms, such as pneumonia, however, can be life-threatening and cause death. Governments around the world have stressed the seriousness of this virus. CBS News chief medical correspondent Dr. John LeBook urges people to social distance, stay clean, and get tested. The test includes a sterile, soft plastic stick being used to swab the inside of the nose and the back of the throat to collect material that was recently in the lungs, where the virus is said to replicate. The CDC advises the general public to practice everyday preventative methods to help reduce the risk of getting sick. These methods include avoid close contact with people who are sick, stay home when you are sick unless you are getting medical attention, cover your coughs and sneezes with a tissue and throw that tissue away immediately. Wash your hands often with soap and water for at least 20 seconds. If soap and water is not readily available, use an alcohol-based hand sanitizer that has at least 60% alcohol. Clean and disinfect frequently touched surfaces and objects. Wear gloves. Wear a mask only if you are sick, can easily get sick, and medical personnel who are dealing with sick patients, because the virus can last for up to 6 to 8 days on the fabric of a face mask. However, not everyone is heeding the warnings. People are traveling due to cheap flights. People are enjoying spring break and getting ready for summer vacation. The symptoms vary from person to person. You may have the symptoms and you may not have the virus. However, you may not have the symptoms and then you may have the virus. You're putting the people around you at risk if you do not practice safe preventative methods. An article titled "Coronavirus 2019," posted by the Center for Disease Control and Prevention on March 23, 2020, provided some stigma and some facts about the virus. Some groups of people who may be experiencing stigma because of the COVID-19 virus includes persons of Asian descent, people who are traveling / immigrants, emergency responders, or healthcare providers. And these stigmatized groups may be subjected to social avoidance and rejection, denials of healthcare, education, housing, and employment, and sometimes physical violence. There are always false rumors in economy. Some facts to know that help to battle these false rumors are diseases can make anyone sick regardless of their race or ethnicity, age, or gender. For most people, the immediate risk of becoming seriously ill from the virus are low. Someone who has completed quarantine and has been released from isolation does not pose a risk of infecting other people. Stress during an infectious disease outbreak can be difficult, cause problems mentally, physically, and emotionally. It is important to support yourself. Take breaks from watching, reading, or listening to the news. Take care of your body and make time to unwind. Hopefully, I was able to better inform you about the disease. So later, the next time you touch something or buy something, think about who could have touched it and where it could have been. Remember to stay healthy, stay safe, and stay cautious.